Well, happy hump day. Welcome to Well Life with Linda. I'm Linda Harris, board certified naturopathic practitioner, and many other things behind that title. I'm happy to be here today. It's been a beautiful day today. I've had a lot going on. I spoke with a group earlier today about some of the things I'm going to share with you tonight. Today I'm flying solo, so I will do my very best to entertain you with some good information about your health and wellness. Let me ask you a question. Are you healthy? How do you know you're healthy? Many things can determine our health. Most often, just how we feel lets us know something is going on. My mission as a health practitioner, natural health practitioner, holistic practitioner, and at my business Well Life is to give you as much information and as many tools as possible that I have so that I can help you achieve your optimal health. Because so much of disease is unseen until it has progressed, and because we tend to push aside those subtle clues of something going on in our body, maybe we think it's just something we ate, we give excuses for that. Sometimes we miss things. We continue on in our stress-induced symptoms as if they'll disappear. We think something's going to go away or it's going to get better without trying to do something about it. My job is to help bring those hidden things to the light. I've talked before about some of the tools I have at Well Life that can help do that. I wanted to discuss today a little bit of a step-by-step of what happens when you go to a naturopathic practitioner or someone to help you find some root causes, find some things, reasons why you're feeling the way you do or what's going on in your body that maybe you can't pinpoint with just a blood test or your normal doctor's visit. I wanted to tell you about the women's top health issues, and so today I wanted to really, I know it's National Mental Health Month, but you know what? The number one cause of death in women is heart disease. 44% of women in the United States have heart disease. That is big. That is a big number. Some of the things that can contribute to heart disease or other than genetic factors are hormonal imbalances, anxiety, depression, your sluggish system, you're overworked, you don't have enough time, so that stresses you out, dealing with others who constantly need you, balancing work and home life, mental and emotional and physical, breast health concerns, weight and obesity. All of these things will contribute to our heart health. You know, part of that is setting boundaries. That's one of the things that I teach as a naturopathic practitioner. You know, making sure that you're keeping a check on your body. Taking care of your mental, physical, spiritual, and emotional health is very important. When someone calls me for an appointment, they're concerned, you know, about their health or their wellness, or maybe they want to lose weight and they're having trouble doing that. Regardless of what they're wanting to find out, I want to get to the core of the situation. So I will use many modalities to do that. Normally what I do is I will assess you. So initially when you make an appointment, I will send you via text from our HIPAA compliance site a form that you will need to fill out, giving me all the information about you. Once you have sent that back and we have your appointment scheduled, I really like to encourage people to do our whole wellness program for 4 weeks. We have a wellness plan. You can see it on our website, Well Life Institute and Institute.com. So I take your wellness form, your intake form that you have sent to me, and I will go over that thing about 3 times before I ever see you. When you come in for your appointment, if we have scheduled for the plan, what we'll do is schedule a thermography, and I'm going to speak to you a little bit more about thermography in a few minutes. But we'll schedule your thermography, and we'll also do a galvanic skin response test. I believe I'm going to have my friend Sherry back soon, and we'll do the galvanic skin response for you so that you can see how that is, how easy it is, and we'll go over a little bit of that with you. But that is one of the things I do. So I already have 3 forms of information, and I believe we need to use as many tools as possible in our toolbox. We have the galvanic skin response, or bioscan, that tells us about different biomarkers in our body. We have the thermal imaging that gives us a lot of information about inflammation. So inflammation is a big marker when it comes to sickness and diseases. Our inflammatory response has a normal way it's supposed to work, but oftentimes inflammation does not get shut off at the time it needs to. Inflammation is actually there to help us heal, but oftentimes it doesn't know when to shut down. So it will cause havoc in our body. We begin to have inflammation in all different areas of our body, which causes sickness and disease. So we do the initial consult. These three things, the initial consult, the galvanic skin response, and the thermography, most often is going to all correlate. So that's going to give me a lot of information about what's going on with you. And as well, I'm speaking with you. I normally spend 60 to 90 minutes per client for your initial intake, because I want to make sure we're going over everything, that we're getting the information that you need, that I need to be able to help you. And you're telling me a lot of things you don't realize you're telling me when I'm talking to you too, so that gives me some more information. Sometimes I will do a physical evaluation. I'm a medical massage therapist, a state licensed massage therapist, and I can tell a lot about your body by checking it out. Sometimes I will put you on the massage table and check your spine out, the alignment, see where things may be out a little bit, because alignment or misalignment can cause a lot of problems in your body with different organs. You've got the nerves connected to the different organs, and sometimes you'll think you're having a gallbladder attack, and it can be that your spinal cord needs to be adjusted, or not your spinal cord, but your spine needs to be adjusted. Also, I do skin and face mapping. I am a licensed esthetician. I've been doing that for over 28 years, and I work with people with their skin, and I normally I don't ever do just a facial on people. I try to work with them from the inside out by what I see on their skin. I can look at your skin most often and tell what is going on inside of your body. So sometimes that's how people are encouraged to come to me to find out how to fix these things. But that is something I do too during an evaluation if I think I need to do that. And of course the thermal imaging, and that's one of the things I want to talk about today. One of the things though that I encourage you to do is to clean up your diet. And when I say that, that's exactly what scares people off, because you know what? We love all kinds of food. We love sugar. It's addictive. We crave it oftentimes when certain things are going on with our body. And when someone tells you to clean up your diet, you kind of don't want to go, because you know you're going to have to get things straight. But when I say clean up your diet, I want you to understand that your diet for your body, if that's what you want to call it, diet, your wellness for your body does not only include food. It includes thought patterns that you may have, your emotional and mental wellness that can be connected to things that are going on in your gut, in your gastrointestinal system, signals to the brain, your vagal nerve. Clean water, that's another thing. Water is so contaminated. Recently, I purchased a water filter. I had been having water bottles for my clients and for myself, so I was always drinking water. Most of the time I try to drink only water now, so I was always drinking water from my water bottle. But you know, we've heard all the information, and it is true that there are a lot of things that leak from the plastics in these bottles. We think we're being healthy drinking water, but then we're getting all the toxins from the bottles themselves. And even though I was drinking a water that I felt like was very safe, it was one of the healthier ones when they had been rated, I decided to get a water filtering system so that I could not only have good water for myself, but for my clients. I drank that water for a good week, and I did a bioscan on myself just because I like to do that every once in a while. And believe it or not, toxins from my waters had improved drastically. My biomarkers, most everything was balanced. So that let me know that the change I had made, drinking those waters in the plastic bottles, and sometimes we can't avoid that, but the toxins that I was exposed to there, you know, you try not to drink from the things that's coming from the faucet because it's got so much put in it to keep it clean. So what do you do? But let me tell you, if you can get you some really good filtered water, a water filter system for your home, it can improve your health drastically. Wasn't trying to do a water advertisement, but I wanted to give you that little bit of information. Also, cleaning up your diet or your life or whatever we're trying to do can include the people in your life. Sometimes we have people in our life that we just don't need to allow to be there anymore, and that can sound kind of cruel, but it's called setting boundaries. So one of the things I do in part of the life coaching that has to do with my wellness coaching is that I teach you how to set boundaries. You know, what are normal boundaries, and we're all allowed to have those. setting a boundary can be really hard for certain personality types. I was one of those people that was that way. I tend to want to help everybody and make everybody happy, and I had to learn to set boundaries. And I want you to know that the first time I ever set a really strong boundary for someone who kept crossing the line with me, it was freeing. My mind became so clear, and I just relaxed. And then each boundary that I did after that was so easy for me to make, because I realized and I understood how important it was and how it made an effect on my wellness. And then, of course, we've got clean air. So all of those things. My degree is in natural health. It's in, the way God intended for things to be for our bodies. And, He give us clean air, good water, a good mind to start with. What we've done with it may not be good right now, but a good mind to start with. So He provided all these things, and these are all things that are needed for our health. We need them to stay healthy. So cleaning up your diet can involve a whole lot of things. Some of the things we do also is I offer healing therapies. And if I don't have a therapy that a client needs, sometimes different things are recommended on our bioscans, I will refer them to someone else who does do those therapies. But some of the therapies that we offer are halotherapy. That is salt. It's a saline salt solution, a medical grade one, similar to like the saline you would do if you were in the hospital with RSV. It helps with breathing, with anxiety, with sinus issues, with allergies, and it just has a very calming effect. So when I'm working with a lot of people who are suffering from a lot of stress and anxiety, and let's face it, most people are having some of that these days. So that is a way to help relax a client, but it also can help you if you have a cold or the flu or something, just open things up and get you breathing better. Oxygen therapy is another way that we can do that. We offer oxygen therapy, not only oxygen facials, but oxygen therapy to help relax your muscles, to help open up your breathing so that you can breathe better. Of course, we do massage therapy, Reiki, lymphatic massage and dry brushing, vibrational therapy, bioenergy and energy work. So a lot of these things that we offer are there to benefit you. And when you do a plan with us at Well Life, these things are drastically reduced while you're on that plan, because we want to make sure that you have access to what you need. While we're doing these things, I'm always teaching you what you can do at home, because I've said this many times, if I do all the work for you in the office and I send you home and you don't know how to do it, or you don't know where to look or where to research or where to go to find answers, then I've not helped you, and it's wasted your money and it's wasted my time, because there's probably somebody else next that wants to get healthy too. So I try as much as possible to teach you, educate you, and give you options that you can have along the way. We're going to break for just a minute, and we'll be right back.
If you enjoy hand-picked strawberries, look no further than Bozeman Farms, with 4 locations this summer for your convenience. The first at Bozeman Farms on Highway 97 East, just off Cool Spring Road, a second on South Winston Avenue across from the fire station, a third by the Shell gas station on Bienvenue Road, our 4th location at Ace Hardware in Tarboro. Fresh-picked strawberries as well as Mama Jean's homemade strawberry jam. And don't forget our sweet potatoes, all available for purchase at each location. Call 252-883-6175 for any questions or directions. Bozeman Farms, from the field to your table at great prices.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
back. So I want the second half of my show, I'm going to go right into the medical thermal imaging. A lot of people ask me questions about that. Some of you may have heard about it, but I like to share as much information as I can. Medical thermal imaging is an FDA-approved adjunct imaging that helps with other imaging like mammography, ultrasounds, x-rays, CAT scans, anything. It is another tool in the toolbox that doctors can use when they're trying to do a diagnosis. None of these tools are diagnostic within their self. Let's just say for breast cancer, for instance, or cancer anywhere in your body, really. You have to have a biopsy to know 100% if it's cancer. But all of these imagings can show changes, whether they're physiological or anatomical, in your body. So what medical thermal imaging does is it shows physiological changes in your body. Normally, I will recommend with my health intake and wellness plan that someone does what is called a thermal imaging health study. That is from the top of your head to your tailbone or your coccyx bone. It shows where your body needs help by indicating areas of inflammation, patterns that may indicate distress, or patterns of cool that could indicate blood flow going to an area. Now, there are different colors. White is the hottest color in the thermal imaging, and black is the coolest. All of us have black noses when I'm imaging us most of the time, unless something really is going on there, because it's so cold. Oftentimes what I see in a thermography when I'm looking at those is a cooling pattern, let's say for women in your breast area or some areas of your stomach where the tissue is denser. When you have dense tissue, it will automatically show up cooler. Sometimes cool shows up when there's something that's going on in your body, but your body is responding and reacting the way it should by sending the blood flow there to correct it. So that's always good information for me. It lets me know that your body's doing what it needs to do. And then sometimes we have different patterns show up, different levels of heat within the body, and it tells us information as well. It can show us many things. I always recommend an initial health study instead of a single breast study. Most people who know about thermography relate it to breast thermal imaging, and that is something that we do a lot of. But I really like to recommend that you do a full body or a health study initially, because you want to create a baseline. And oftentimes, let's face it, when we go get a mammogram, for instance, and your breast is placed between these two plates, and that is the only area that they're imaging there. So unless you're sent back for a diagnostic or an ultrasound where they do way more, that's all that you're going to get an image of. And so often breast cancer is found, under the arm, down the arms. I told a story today when I was talking to a group of ladies about a woman who had breast cancer, but it was found up in her upper chest area. I always, when I do just a breast imaging, I will include a heart and chest check with that as well, because women do die more of a heart attack than breast cancer, or heart disease than breast cancer. So I'm always trying to do as much as possible. But if you've got something going on in your lymph nodes, or you've got inflammation in your body that could signify that you're on your way to something if you don't make changes, we need to see that, and we need to have something to compare it to. These images are read by physicians who are trained to read these the same way radiologists would read an x-ray or an ultrasound or mammogram or something. So it is read by them and sent back to us, and then we give you your information. You can then share that with your doctor. As a matter of fact, I recommend that you do, so that they can keep it on file. It's so important to get this, because creating a baseline that is physiological can show us so much about what's going on in your body. It can let us know if the protocol that we're using on you, or that your physician is using on you, is working. It can let us know if you're getting better. I did an image on a lady recently who, about 4 months ago, who some things didn't show up so great, and they said she needed to follow up in 3 months instead of 6 months to set her baseline, and this was for breast imaging. And so she began to do lifestyle changes. She listened to what we were sharing with her, and she changed some things. She got rid of sugars, of sodas. She started doing some other things within her body and within her health, and trying to have some me time, some relaxation time to reduce stress. And when we just did her follow-up baseline, it was very much improved. And so to me, this tool is so important when I'm working with a client, because they can see, it's a visual aid, so to speak. If I'm working with someone and I've met with them and they've talked to me about what's going on with them, and then I'm giving them recommendations or directing them to someone else who I think may be able to help them more, and they're kind of iffy about what they want to do, when they see this thermal imaging, it becomes real. You know, none of us want to give up the things that we love to eat, whether they're good for us or not. And I always do recommend that you make lifestyle changes. Again, that includes some of the things I listed earlier, that you make changes in your diet to improve your health. And when you see that later, when you've had another thermal imaging, you're able to see the hard work you put in. It will also encourage you, because you've seen that visual, to continue that hard work. You know, so many times people are working on their weight or working on their health or trying to do something better, and they think once they start to feel better, and I see this happen a lot with clients, they'll start to feel better and they'll be like, okay, I don't need to do this anymore, I'm feeling better. And they've not allowed their body to heal. It didn't take your body, 5 days, 2 weeks, or 4 weeks, or even 2 months to get in the condition it is that sent you to someone like me or to your doctor. And it's not going to take that little amount of time to heal your body. Normally what I encourage people to do is to continue on. That's why it's called a lifestyle change. And making a lifestyle change can make such a difference in our body. I wanted to share with you something else. I brought it up on my phone so I could remember. I took a photo of it actually in a training I did, where they had done some studies on inflammation and depression. And because we're talking about inflammation, because thermography picks up inflammation in your body, which gives us key answers to some things that are going on and helps. But it was by a doctor. Let's see if I can get it back up here now. Have you ever noticed how nothing wants to work on your phone whenever you're trying to use it? Okay, so it's was done at Yale University. It's not showing me the professor's name now, and in neuroscience, Stony Brook. I don't know, but it's saying depression can actually be a form of infectious disease. That is something they're questioning now, because it is associated with biomarkers of inflammation. Inflammation in our body is caused by so many things. And if you've got someone who can work with you and take the time with you to find these areas and go back and trace where they begin, oftentimes you can correct those and you can live a much healthier life. We're so exposed to toxins, I was just reading an article about the glyphosates in I believe it's the Roundup, that we've heard so much about, and how long we've been exposed to those things. Those are the things, some of the things happening in your body right now, if you're having issues, could be traced way back to years, even to childhood. And talking about mental health awareness, a lot of mental health issues and anxiety and stress and panic attacks, a lot of those things are due to trauma maybe that happened from when we were younger. It could be trauma can come in many forms. It doesn't have to always be a mental or emotional trauma. It can be a physical trauma to your body that can cause a chain reaction because the inflammation did not cease doing what it was supposed to do at the proper time. So then that caused inflammation and things to happen in your body. So pay attention to what's going on with your body. Listen, I always tell people, keep you a little notebook. Keep it by your bed at night. Write a note every night about a few things you did. You don't have to write a whole book. You don't have to write a chapter. Just put some notes. What I did today, how I felt. You can begin to trace things and how they affect you. Foods that affect you, you can trace those. People that you were around. I saw Aunt Bessie today, and this happened, and I had a panic attack. So something about Aunt Bessie, maybe she's crossing a boundary. Maybe you've not set a boundary for her. I'm just giving you some examples of things that can happen in our life that affect our health and wellness. I always want to share a little bit more with you about some of the things we're doing at Well Life. Oh, I do want to tell you this before I forget. I had Noelle Butler on my show 2 weeks ago, and I did a correction last week, but I want to remind you again this week. We had said that her art showing and her first day reception of the art showing at the Dunn Center was on the 15th of this month, but it is on the 16th, Thursday the 16th. So please make sure you try to go by the Dunn Center, see her. The reception's that night. She will be there. You'll be able to meet her and see her and talk to her about her work. But you also, I think it's going to be there for a little while that you can go back and visit as well. But I just wanted to make sure you had the right dates on that. I'm trying to get that out since we had put the wrong information out there. Also, let's see, I got a little off track. What was I fixing to tell you guys? We were talking about mental health and wellness and how things affect you and how, our bodies are affected by so many things that happen. Take time out. I think with mental wellness awareness, we really need to learn to take time out for ourselves. The group of ladies I was talking to today, I mentioned to them, they were more my age and up, and I mentioned to them that we needed to take time to take self-care for ourselves. We weren't used to doing that when we were growing up. So as I get ready to leave you, I just want to remind you, take time out. Go outside and smell the roses, as they used to say. Take a walk. Take a 20-minute power nap. Thank you so much for joining me tonight. I hope you've learned some information. If you have any questions, you can text me or call me at 252-363-7721, and you can go to welllifeinstitute.com for more information. Thank you so much, and I hope you have a wonderful, healthy evening.